Hello, I'd like to introduce you to Rob Weckler from Weckler and Associates. Rob's the owner of an outpatient substance abuse service, and within that service, Rob also does DUI evaluations and programming. Welcome, Rob.
Welcome. Thank you, Mark.
Rob, let's first start with explaining how people would get to refer to you. And how people come in, enter in regarding the DUI services.
Okay, for people who've just been written a ticket for driving under the influence, the first thing they usually do after the ticket and after they may have to bond out of jail, the first thing they do is usually hire an attorney, and the attorney will give them, or if they wait to go to court for the first time for the first hearing on the DUI, the court will give them a list of people who are licensed in the area to do DUI evaluations. Now, I'm licensed in Illinois. Wisconsin will accept Illinois evaluations, even if there's a DUI in Wisconsin, if the person who got the DUI is an Illinois resident. So I do a lot of DUI evaluations that are also used in Wisconsin, the same form for both states. So that's how I get people, usually either through attorney, through court, from a court list, or word of mouth from other people who have had DUIs.
When you mentioned that you do, that you also do, that Wisconsin would recognize it from Illinois, does the place of arrest have anything to do with that as far as where the DUI evaluation would be done?
In Wisconsin, they would give the defendant, the court would give them a list of places in the area that they would refer them to. However, if the person is an Illinois resident, they would not hold them to a Wisconsin referral. They would allow them to do an evaluation in Illinois, and they would accept that evaluation.
Explain your evaluation process. How do you assess what level of care they need? What level of cares are there?
Okay, there are four different, they're not called level of cares, but they're called risk. Minimum risk, moderate risk, significant risk, and high risk. They used to be called levels 1 through 3, but now they just go with those names. As far as the assessment's concerned, it's the same for everybody, no matter what risk level they wind up in. There is an interview, a clinical interview, asking them about alcohol and drug use history. Also, they need to bring in their driving record from whatever state it is, either Wisconsin or Illinois. And that way we can see, have there been any other alcohol-related offenses, and if they have, then those would be part of the criteria for classification. There's also a clinical questionnaire. There are 4 different ones that are used in Illinois. A couple of them are called ASUDs. We use one called the Driver Risk Inventory, which evaluates not only their alcohol use, but also drug use and consequences, and driving as well, and also has a category for anger management. So it gets a little bit more than, it's not just the DUIs, it's what is the person's history, what is their whole alcohol and drug use history. That's taken a sequential, beginning when they first started to experiment up until the day of the evaluation is taken. That goes in the evaluation. Now, we use the same criteria clinically that somebody outside of doing any kind of an assessment would use to be able to assign diagnoses of abuse or dependence or experimental use, non-problematic use at all. As far as the classifications and what the criteria is, I can give it to you, I hope, pretty simply. Minimal risk. First ever alcohol-related DUI arrest or drug-related DUI arrest. A blood alcohol concentration score of under 0.15, so that would be 0.14 or lower, and no history of symptoms of alcohol or drug abuse or dependence. No history at all, symptomology. That's called a minimal risk. That is somebody who would then be court ordered to do 10 hours of DUI risk education. They have a different name for that in Wisconsin, but it's pretty close to the same. It's education. The intervention is education, it's not therapy. The next category, moderate risk, first ever DUI arrest, never had any symptoms of alcohol or drug abuse or dependence, and their BAC score is between a 0.15 and a 0.19, which is pretty high, but it's way out of character. They've never drank like that before, hardly ever, or they refused the test. They refused it. If that's true, first ever arrest and all that stuff, they're in the moderate risk, and they would have to do the 10 hours of DUI risk education and something called 12 hours of early intervention, which is a little bit more education about alcohol and drug use, but mostly alcohol for most clients. The third category, if a person's ever had a DUI arrest before, even if it's reduced to reckless driving, if it was 20 years ago, on the second arrest, or if on the first arrest they score a .20 or greater on blood alcohol concentration, or if on the first arrest there's any symptom of alcohol abuse or dependence, or drug abuse or dependence, then those folks go into what's called a significant risk category. That's a diagnosis of abuse to whatever substance. And they would have to do 10 hours of DUI risk education and a minimum of 20 hours of outpatient substance abuse treatment. Most places would do that treatment in groups, the variety of it in groups. And that's the significant risk. And the last one, the high risk, if somebody has a clinical diagnosis of dependence for either alcohol or any kind of drug, mood-altering drug. In other words, from the old DSM-4, if you're working with that knowledge, you know, three or more of those symptoms of dependence in a 12-month period. That is a diagnosis of dependence. That's high risk. High risk is a minimum of 75 hours of outpatient treatment, or that could be done residentially. And if a person's had 3 DUI arrests within a 10-year period, but for some reason the evaluator doesn't find enough criteria to meet a diagnosis of dependence, then that person goes in high-risk non-dependence, and they still have to do 75 hours of outpatient treatment. But then the court demands that the evaluator find out what is the reason they got those 3 DUI arrests if it isn't dependence, and that needs to be treated and addressed during treatment. So that's basically the symptom, the system: minimal, moderate, significant, or high risk. And most places that do evaluations also do all of those levels of care.
What would the evaluator look for a conclusion? You said it could be a minimum of. What would be the criteria to decide if it's just the 75 hours or more?
The evaluator does not have the freedom to be able to make up or create number of hours, add extra ones, or reduce them. The evaluator simply puts them into the criteria established by the state: minimal, moderate, significant, or high risk, and there's an automatic recommendation for each one of those. So the treatment provider now can do things when they're in treatment if they come in, but the evaluator just simply comes up with the evaluation and the classification.
What would be the criteria for the treatment provider as far as successfully completing the program?
Well, successful completion of treatment plan, and I think, of course, mostly we'd be looking for abstinence, and we would be looking for a person finding a sober peer support system for himself, or a sober support system for himself afterwards, and that the person has an acceptance that they really cannot manage their drinking or their drug use anymore, that it's something that they need to abstain from, and that it's chronic, and if they go back to use in the future, they'll have the same kinds of problems, maybe even worse. When we see those kinds of things, then we will call that, that's the criteria basically for successful completion.
Being familiar with other types of DUI services within the area, what would be a range of costs that someone may expect, just from the treatment aspect, from the least amount to the most?
If we took McHenry County, which is probably the most reasonable for clients, the cheapest, of all the counties that I'm familiar with, certainly much cheaper than Lake County and a lot cheaper than Cook County. For example, a DUI evaluation at some places in McHenry County might be $50. In Cook County, that same evaluation would be $200. A minimal risk program, 10 hours of risk education, some providers in McHenry County do it for $80 or $90. In Lake and Cook County, that might be $160 to $200. As far as intensive outpatient program or an outpatient treatment for high risk, the 75-hour one, and a lot of places do intensive outpatient, which is at least 3 or possibly 4 nights a week or days a week, at least 3 hours per session. So it would be at least 9 hours a week for the small kind of IOP or the shortened kind, and it could be up to 15 hours a week for others. Those are more expensive usually than the other ones, not only because of the hours, but the number of sessions it takes to make the hours. I guess there are some places in McHenry County that might do the 75 hours for $900. And in Cook County it would probably cost $2,000, $2,300. So that would be the range, anywhere in between. Now, there are some places that have sliding fee schedules, and if they do, and the people qualify, they might give it to them for $5 a session. You know, it might cost them like $120 for the whole program. It depends upon, and if a person's Medicaid, and the provider has a contract with Medicaid, well then of course that would take care of it. There are people who are able to use their health insurance for outpatient addictions counseling, and so that of course would lessen the cost for the defendant.
From your best guesstimate, what would attorney fees range in these types of cases?
For a first offense, I'd say anywhere from $1,500 to $3,000. Second offenses are usually more expensive because the first thing the attorney says, well, the first thing we have to do is keep you out of jail, because on a second offense in Illinois, person cannot get court supervision more than once in their lifetime. So the first offense is court supervision. Whether it's 2 years later or 20 years later or 30 years later, they can't get court supervision again. It's going to go down probably as a conviction. Conviction means the license is revoked. The other option is the court may decide to reduce it to reckless driving, where the license isn't revoked but it's suspended for a period of time. So the attorney is saying, well, I've got to do more work on this. And if it's a third offense or a fourth offense, you can see the fees could just go up.
How long from first arrest until the completion of the program would you say is a guesstimate how long that whole process could be?
Well, it depends how many hours of education or treatment they have to go through, but generally the courts give the defendants a year from the date of sentencing, 1 year to complete it. Now, if there are people in the high-risk program and they're going at a slow pace and maybe doing 3 or 4 hours a week, it could take them a half a year. And then the aftercare or continuing care is frequently recommended. And sometimes that would be 6 months. So it would be easy for somebody in the high risk to go outside of a year. But they could also finish it within a year too if they did it quicker. 10 hours of DUI risk education, most places do that. Some places do all 4 sessions in a week. Some do twice a week for 2 weeks in a row, so that'd be really quick. Significant risk, which is 30 hours, might take as much as 6 weeks or 7 weeks, multiple nights a week or days, whenever the times are provided. So, but everything should be done in a year, and possibly the high risk might take a little longer. The other ones should all be done within 3 months easily.
What portion, if at all, during that time may a person see their license being suspended, if at all?
Okay, what happens is, on the 45th day after the arrest, I'm arrested January 1st in the morning from partying. The 45th day after, which I guess would be February 16th? No, it wouldn't be. It would be like February 13th, whatever it would be. Starts 30 days, actually starts the suspension, okay? 45 days after the arrest, the suspension starts. If I have refused to blow in Illinois, and this is my first arrest, my license is suspended for 12 months. If I have chosen to blow and I blow a .08 or .10 or .20, it doesn't matter, my license is suspended for 6 months. So 45 days after the date of the arrest starts the suspension. The first 30 days are known as the hard 30. There's no driving relief at all. So that's the part that panics most people. How am I going to get to work? How am I going to get the kids, etc.? And they have to make arrangements. Usually on the first offense, it's almost always happens. The person is granted a hardship driver's license, which would be a blow device in the car, okay? Which they have to purchase, and they have to pay maintenance to and pay rental for. So for the first 45 days after the arrest, there's no loss of driving privileges. Then starts the 6th month of the year suspension, the first 30 days of which no driving relief, so the driving relief would start on day 31. So most defendants are looking at 30 days without being able to drive and getting a hardship after that.
Would there be special circumstances involved with a CDL license?
The CDL license, it takes, the blood alcohol concentration doesn't have to be 0.08 for a DUI like it does for other people, it's at 0.04. So if you're talking about would somebody with a CDL license be able to get a hardship license, you mean, and work during that time? That's a good question. I'm guessing probably no, but I'm not really sure.
Okay. When people are involved in your program, what types of other tools may you use during the process? Do you do drug screens here, breathalyzers? We
have a portable breathalyzer in each office. We have urine drug screen kits. That is not admissible in court, but most of the people that we use urine drug screens on are people who are on probation, and probation usually does drug screens, so we kind of work it out in between. So yeah, we would do both.
Mm-hmm. What other information, any questions that I may have left out that would be helpful for people to know about?
Okay. One of the big areas of controversy involves should I blow or should I not blow? Or should I take the test or not take the test? And folks will say, gee, my second cousin was a Chicago policeman for 30 years and he said they could make those breathalyzers look like whatever they wanted, so don't ever blow. Well, the way the law is written is the first time that you refuse to take the test, and that could be a blood test or a urine screen or a blow. The policeman it's their call if they think there are signs of the person influence one way or the other. If the person refuses, they lose their license for a year the first time in their lifetime. If they ever get a DUI again and refuse the second time, they lose their license for 3 years and there's no driving relief the second time. So some attorneys will say, don't blow because you're giving me something to work with and they don't have the evidence. And that could be true in certain cases, but more often than not, the person gets the DUI anyway. And especially when people complain that, gee, I only had a couple of drinks and I really wasn't under the influence, but I didn't blow because my attorney told me never to. If that was true, they're helping to make the attorney rich because they have to hire an attorney once they refuse to blow because they're charged with DUI. If they do blow and they're 0.04, there's no DUI. Never hire an attorney. So there's a kind of one wonders, as to the motivation sometimes. But I'm not an attorney, so I just try and help them understand what the law says and what the consequences are each way.
Right. Again, I appreciate your time. Rob Weckler from Weckler and Associates. Thank you very much.
Thank you.